Select the appropriate OpClear sheath diameter, angle and length to fit the laparoscope to be used. Always make sure you check the expiry date. After checking, open the packaging using sterile technique and place it onto a sterilised surgical table. The Disposable Procedure Kit comes pre-assembled in a sterile pouch and consists of a sheath, wash cartridge, CO2 and wash delivery tubing, CO2 connector and filter, saline connector and filter, and a drape clip. The stopcock on the OpClear wash hub should initially be in the fully open manufactured position when removed from the packaging. To fill, rotate the stopcock 90 degrees clockwise so that the middle arrow is facing towards the wash cartridge. Then, simply connect a 10 ml syringe to the lock port and slowly advance in 10 ml of saline. It should never be filled with any more than 10 ml of saline at any one time. Once the cartridge is filled, rotate the stopcock 90 degrees to the operating position before removing the syringe. If the system runs out of saline, it can quickly be refilled without the need to remove the scope from the abdominal cavity. This is done by rotating the stopcock 90 degrees counterclockwise so the cartridge can be filled. Connect a new syringe filled with 10 ml of saline and refill the wash cartridge. This will allow the procedure to continue as normal. Once saline has been refilled, turn the stopcock back to the operating position. Before assembling the laparoscope and the OpClear Disposable Procedure Kit, prepare the scope by using a wet swab to clean the lens. Once the laparoscope is prepped, align the distal tips of the laparoscope and the OpClear sheath, ensuring the gas and saline ports are facing the 6 o'clock position. Gently clip and push the OpClear tip in, increasing pressure along the length to ensure a tight connection. Once in position, check that the light cable and gas and saline ports are at the 6 o'clock position. Also check the tip to confirm that the sheath is aligned correctly. Now connect the procedure kit by plugging the CO2 and saline connectors into the control unit. The message PRI will appear on the screen. Before advancing into the abdominal cavity, prime the OpClear Disposable Procedure Kit by pressing the foot switch once. The display on the control unit should read Auto. This means that the auto demist is operational and the procedure can begin.